I'm in Sumatra. I'm about 2 hours north of Padang, the city where a lot of the focus has been, and I've been looking at a lot of the worst impacted areas today. Last Wednesday there was a large earthquake just off the coast of Sumatra, not far from the city of Padang, and the impact it had was quite considerable. It's destroyed a large number of residential properties as well as commercial buildings, but it made a lot of people homeless. Some of the worst affected areas are to the north of Padang. Towns close to the ocean have been very badly affected, but also the villages and towns in the mountains have been hit by landslides, and a lot of them are isolated because the roads have been pushed away. Children in particular, there's a great deal of concern. At the moment, because also it's raining quite regularly, there are a great number of children living with neighbours or in the front gardens of the houses that are destroyed in very bad conditions. So a number of health conditions can stem from that, including respiratory tract infections because they're having to sleep outside during the rain without adequate shelter. There's not the appropriate hygiene materials getting in. We've started distributing those now, but hygiene is of great concern to children, and also just the protection issues as well. There are children that are separated from their families, and there are also children that are having to live in very cramped and communal environments. As we talk, I'm driving through a town which has every front garden has some makeshift tarpaulins in front, with families living in them. A large number of the houses are either damaged or completely destroyed, and people are just living outside of their properties. Quite often in areas where that's not possible, you'll have 2 or 3 families living just under sheeting in the front gardens of destroyed properties. Save the Children, because we had pre-positioned stores in this area, is actually one of the very first organisations to be out and distributing. And we're distributing the basic essentials for life. We're giving shelter kits to people so they can have some form of coverage from the elements. We're distributing household kits so they have the basics to cook and wash and transport water. We're distributing purification tablets so that water can be potable. And we're distributing hygiene kits so people can stay clean and hopefully ward off disease. These are the basic things that people need to re-establish some form of normality in their life before they go about the business of reconstruction. The immediate challenge is getting to the outlying areas that have been very badly affected and are yet to receive any assistance. Logistics is difficult in this environment. Some of the roads are in very bad condition, and even finding warehouses where we can forward transport our stores that we pre-positioned several hours away in Medan. But we're overcoming those challenges. We're getting a great deal of assistance from the community, a number of volunteers, and we have some brilliant staff here who are very good at mobilising the community to assist. So we're overcoming the logistics challenges, but it's certainly not easy getting out to the outlying areas. The message I think we need to get across is that these people are not going to only need help in the immediate term. They're going to require assistance not only to get these basic necessities of life right now, but also for the foreseeable future, to help them re-establish their lives, reconstruct their houses, get some dignity back in their life, and also re-establish the most important things such as schools, education, and allowing children to have some form of normality return.